Can you tell us what heart disease is?
Heart disease is a problem with the heart. There is like so many different types of heart disease. So when most of the time when doctors are talking about heart disease, they mean cardiovascular disease, or the arteries of the heart are blocked up in some way. And that comes from clots that form either chronically, that clots form and then they get what's called organized, or they scar down. And those scarred down clot areas get calcium deposits, and that's why we do our coronary calcium score.
Hello, hello. Welcome to the Healthy Heart webinar. We are back with Dr. Saunders, Cheryl. I was going to say, I still sometimes want to say your maiden name. It's Cheryl Raby. Yep. And it's me, Leslie. Yesterday we did the diabetes webinar and someone commented, who's that guy in the t-shirt? And it was Joe, our founder, who was on the webinar. And I forgot to introduce him. And so some people were like, I don't know
who's that guy.
Just a random dude not talking.
Yeah. In fact, he was playing around with his camera where he'd freeze it so it looked like this. Remember when we did that AI training? I don't know if you were on that.
Yeah.
And they had the guy, it looked like he was paying attention, but he actually wasn't. It was just like an AI version of him. And he was actually working on stuff. Joe was playing around with some of that. So it was kind of funny. Anyway, hello. Go ahead and comment in the chat. Let us know that you are here. Douglas is here from Tampa Bay. Honestly, Tampa's one of my favorite places. I really like Tampa.
Douglas, I'm from the Fort Lauderdale area, so a couple hours away.
Yes, you guys are in the beautiful places of the world.
Oh, Dunedin, Christine, how do you say Dunedin? I don't know that. I don't know.
In Florida, better than Tampa.
Better than Tampa.
Annette from Arkansas. Christine says it's better than Tampa.
Dunedin. Oh, okay. I think I said that right. Thanks.
Claire, hello. Rose, hi. We got our Canadians in the house.
Our Colombians too. Hi, David Brown.
Awesome.
Puerto Rico as well. Ooh, let's go on a tour.
Yeah, for real. Dr. Saunders was speaking Spanish on our call, on our chat yesterday. I totally misinterpreted what he said. It was so sad.
Because there was somebody from Colombia, and so, I had to speak Spanish.
David? Is that his name?
Yeah.
Yeah. He's is on the webinars. We love to see that he's hopping on all the time. Oh, Terry, you're back. Hello, everyone. Oh, they're scrolling so fast, I can't keep up.
Peggy Sue from Oxford, Florida.
Look at all these Floridians. Cheryl's attracting all these Floridians. This is great. Okay, guys, welcome to the Healthy Heart webinar. Hello, John from sunny South Carolina. Oh, look at all you guys. Just great places. San Diego. I'm in South Dakota. Cheryl's in Florida. Dr. Saunders, I believe, is coming to us live from California. You are not in Santa Barbara. You are in Goleta.
Solvang. It's a little town north of Santa Barbara. It's really nice.
Is Solvang like Swedish or Danish?
Danish. Yeah.
Danish. Yeah.
Yeah. There was a school here that was a Danish school, so they decided to make it into a Danish community, and there are still some people from back then, from the Danes that live here. But you come here and there's Danish restaurants and all the architecture is Danish and all that stuff. So it's kind of fun because they got big windmills and all that good stuff. It's kind of fun.
That's very
cool. I've heard Danish pastries are really good too.
They've got a few bakeries here and they're good, but it's been a long time since I've eaten any.
You're so strong, Dr. Saunders. Way to go. Oh, why does Leslie have a t-shirt on in South Dakota? You know what? It's like 70 some degrees here. South Dakota isn't always cold, believe it or not. I actually have my windows open in my home, and yeah, it's a great day. It's a great day here. We definitely experience 4 seasons in South Dakota. So I'm excited that you guys are here. So sometimes we have these plans for the webinar, and then we start talking to Dr. Saunders, and then I have to tell him to stop talking because I want to save it for the show. And so he was starting to give us all this good information. I'm like, no, everyone else wants to hear this too. So we were talking about different heart things, and Dr. Saunders shared he had a so did all of this kind of come to a head today? Or when did you make this discovery, Dr. Saunders, for this patient?
Well, just today. Today, all the tests came back. So she came in for her test results. And so we had all the tests come back today.
Okay, start from the beginning. We got to hear this.
So this patient is 77 years old. And so she was in my office and we were talking. We'd gone through all these issues that she's had. She failed a tilt table test. So she had some POTS syndrome, which is postural orthostatic hypotension, low blood pressure. So, but she was sharing some other things that were weird, like her oxygen level. She had one of those pulse oximeters, and her oxygen level would be great if she's sitting there quietly, relaxed, and everything. But if she's up doing anything, it drops like to the 40s or 50s. Like nobody drops to the 40s or 50s unless you have some really bad lung disease. So we tested her lungs, we tested her blood tests and all that, and nothing came up positive. And then she came back in a while back, and she said, "Oh, you know what? I was just remembering my mom said that I asked, about my birth, and she said, well, I didn't get to see you because you were blue for 2 days, and they wouldn't let me see you." And so that's back in the 1940s, right? So it was a long time ago. And they didn't have echocardiograms to look and see what the heart was like or anything. So they could give oxygen and not do very much else in the 1940s. So they didn't do anything. So she went on. She was a cardiac nurse. She was a nurse working in the cardiac ward of a hospital, and she's seeing all these people with all these heart problems and stuff. And so this all passed by her, and she's having issues all her life. She's having issues with low oxygen and fatigue and weakness and all that stuff. So it comes this, and I'm like, oh, really? So we did it was called the TEE, transesophageal echo, and this is a special kind of echo that they put bubbles into the blood, and they try to see if the bubbles go from the right side. They put it into the veins, and it's supposed to go through the lungs, and then the bubbles will completely dissipate in the lungs. But if when they're doing the echo, if they start seeing bubbles on the left side of the heart, because the echocardiogram can see bubbles, and if they start seeing it on the left side, then they know there's a hole in the heart. That's what she has, a hole in the heart. So here she is, 77 years old, barely diagnosed with a hole in the heart that she had when she was a little infant, when she was first born, and she was blue for 2 days because it's not uncommon, because you actually do have a hole in the heart when you're when you're in the womb, but that's supposed to close up when you're born. So sometimes it takes a couple of days. So they thought, oh, she pinked up, so that means it finally closed. The old foramen ovale closed. So they always thought it was closed, but it turns out it's not. Isn't that interesting?
Mm-hmm.
So what led you to go there? Because she told you that she was blue when she was born. Was that kind of the thing that led you to that? Had maybe no one else ever asked her that before?
Yeah.
No, it turns out that, she's working in cardiology, and she was telling one of her friends one time, one of the cardiologists there, she's talking to him, and she says, I put that little oxygen meter on. This before everybody had one. So this was a long time ago, and it was brand new. She goes, I put that oxygen meter on it, and mine dips into the 50s sometimes. And he goes, you might have a hole in your heart. But that was like the end of it. And then, so 20 years later,
Wow.
She's finally gets the test and finds out that that actually is happening.
So what do they do for that?
Wow.
They have this really cool like umbrella thing that it's of course very little, you know, it's like 5 to 10 millimeters, and they put it through a wire, and then it goes into the heart. They put it through the hole in the heart, and then it pops open, and then they pull it closed, and it kind of like snaps two round things together. They call it an umbrella. They can just pull it together, and then that holds. Uh, it's just not stitched or anything. It just stays there and plugs the hole. It's a plug. That's all it is.
Interesting. All right. Well, since we're this deep into this conversation, I'm just going to share my screen here. Do any of these look like what you just talked about?
Yeah, patent for a middle valley. Yeah. Does. Yeah, that one. And then they show in this middle one, they show the whole how they plug it. Right there. They show you how they plug it.
Which one? This? Right
Yeah.
here?
Yeah, that one. And the one next to it shows you how it's plugged. They
Wow.
put the
How-
wire in and they plug it up.
It just stays there because of the pressure in the heart, because of
Yeah.
the electricity in the heart. Like, how does it?
No, well, it stays there because there's two sides, and so one's on one side, one's on the other side, and then it's held together in the middle, so that it just plugs it up, stays
They're
there.
kind of like magnets for each other?
No, not magnets. There's a wire that connects
Wow,
them.
okay, got it.
Wow. Okay.
And this looks like it's minimally invasive, so it's an actually pretty easy procedure relatively for a heart problem.
Yeah, well, yeah, relatively for a heart problem. Yeah, you don't have to stop the heart. You don't have to go on a heart lung machine. Yeah, actually, compared to the old way of doing it, absolutely, it's a lot better.
Annette says she was meant to be here to have lived so long and well with that birth issue.
I know, right? I know, like, yeah, crazy.
Very cool. Very, very cool. Well, that is fun. And I know that those types of things give you a lot of joy because it's like solving a mystery. And so
Yeah,
I
that's
know
what I
that
love doing.
I know, and it's fun. And it's fun to even just see you get
Oh,
excited about it.
I want to do a new website. I thought of this really cool website to have like all like a cartoon website of a medical detective, you know, and you have the little magnifying glass on there, and it's all a cartoon website. Dr. Saunders Medical Detective.
That's awesome. I love that. And Dr. Saunders has worked on some things for, all of us on the team as well. And that's what we're here to do on this webinar, is to talk about what you can do with the problems that you're having with your heart. And so I know that some of the questions are starting to come in, and we want to get to those. Before we get started, first of all, Dr. Saunders is not your doctor. And so any of the things that we discuss here, we would recommend that you discuss with your healthcare provider first before you implement. And I want to just talk a little bit about heart disease, because primarily that is what we talk about here. Can you tell us what heart disease is?
Okay, heart disease is a problem with the heart. There is like so many different types of heart disease. So when most of the time when doctors are talking about heart disease, they mean cardiovascular disease, or the arteries of the heart are blocked up in some way. And that comes from clots that form either chronically, that clots form, and then they get what's called organized, or they scar down. And those scarred down clot areas get calcium deposits, and that's why we do our coronary calcium score. Coronary referring to the arteries of the heart. So heart disease in most cardiology practices is primarily looking at the arteries of the heart. However, there's a lot of other heart disease, and cardiologists would be very familiar with that, like the hole in the heart. Somebody asked, where exactly is that hole in the heart? Well, between the two atria, so you have the two ventricles, or the big one pumps, and then the little ones up top are called the atria. And when you're in the womb, you're not breathing, so there's no air in your lungs. So because of that, all the blood vessels are constricted, and everything is There's no blood going through the lungs at all. So there's actually a hole in the heart between the two atria. That septum that's there has a hole in it, so that all the blood goes through the hole into to the left side and then goes out to the body. So the circulation bypasses the lungs entirely. But when you're born, you take a deep breath and the lungs open up, and then all the blood vessels open up and all the blood starts running through the lungs. And then that foramen ovale, that hole in the between the atria closes up, and then you have the normal circulation going through the lungs, and then through the body, and then through the lungs, and then through the body. So it doesn't bypass the lungs anymore, but hers remained open. And so that's that kind of thing, a hole in the heart, or atrial septal defect. Other kinds of heart disease include energy problems of the heart. We call it heart failure. And failure just means it's not pumping enough. So it should pump more, it's not pumping enough. So sometimes it's left heart failure, where the left side that's going to the body is not pumping enough. So it kind of backs up. The right heart is pumping it into the lungs, but the left heart isn't getting it out. And that's there's not enough energy in the heart. So that energy could be sometimes because the arteries are blocked. That would be one reason for it. But there's a lot of other reasons. When you have decreased mitochondria. Mitochondria are what exchange the energy from glucose to ATP. And ATP is what the cells use for energy. That's what the muscles use for energy. That's what allows that to keep going. So if you've ever been fatigued and you've like run a long distance and you're going, oh my gosh, I can't take another step. Why not? Well, because you've depleted all your ATP. You have no more left. So there's no energy there for the heart, for the muscles to be able to reset. So there's no energy in the muscles at all. And then you have to wait. And sometimes it can take minutes, hours, even days for some people to rebuild that ATP so that their muscles can work again. So if you've ever had like people with chronic fatigue, they will they'll say, well, I don't care if I'm fatigued. I'm just going to push through and I'm just going to do what's got to be done. And they do what's got to be done. And then they collapse. And it'll be 3 or 4 days before they're able to get out of bed again. That kind of thing is called payback. And really what's going on is you've depleted all your ATP. You just push. You have no more ATP in there at all. And the chronic fatigue is a lack of the ability to make ATP from those mitochondria. So what happens is that it's going to take a long time to replete your supply of ATP. So that's why you're in bed, unable to move for days. Well, your heart has the same issue, but the difference is in your muscles, in your body, you might have 10, 50, maybe 100 if you work out a lot, mitochondria in each one of your muscle cells. In a heart cell, there's thousands, like 4,000. There's 100 times more of those mitochondria making ATP. Why? Because the heart can't stop. You can't rest for 4 days. You can't okay, just stop my heart for 4 days so I can replete the ATP. No, that's not going to happen. So your heart has to keep going and going like the Energizer Bunny, right? It can't stop. So it can't run out of energy. So you've got to have that ATP going all the time. Well, what happens if you make fewer and fewer mitochondria? Then you have less and less energy. And then all of those other things start happening, like congestive heart failure. Like your heart just can't beat as much as it used to. So it slows down. It gets arrhythmias. It instead of pumping like all of the blood out, it only pumps a little bit of the blood out because that's all it can get for ATP. So it's the ejection fraction goes down, and that's where it starts backing up into the lungs. The lungs fill up with water, then it backs up from there into your veins, and your ankles start filling up with water. I had a guy who came in with congestive heart failure. his heart just was not pumping. He had a 20% ejection fraction. And so every time his heart beats, only 20% of the blood is being pumped out. 80% of the blood is still left in the heart. And so he came in and he was on hospice. And he said, it's a nursing home, right? And he's on hospice. And so I said, okay, so you've come in, you're on hospice. That means you're going to die soon, right? He goes, oh, I don't want to die. I said, you came in on hospice. You told them that you were ready to die. No, I don't want to die. Some doctor had to certify that you had less than 6 months to live in order to be on hospice in the first place. He's like, no. I said, okay, so you do have other options. And he's like, what? What's my other option? I said, I can't help you with this. You have to do it. And he's like, okay, I'll do it. I'll do anything. I said, okay, don't put anything in your mouth for 2 weeks. Nothing. What? No water? No water. He was like so bloated all over the place. His belly was That's interesting. His belly was bloated.
Very dramatic.
Yeah. His face was bloated. His arms were thick. He couldn't even move. They had to lift him into the gurney, into bed, from the gurney into bed. And so he said, oh, is that all? I can do that. That's easy. And I'm like, fine. I said, they're going to bring you food every day. They're going to force you to drink water. And you're going to say, no. And he did. He said, no. In 2 weeks, he lost 100 pounds. 100 pounds. So how do you lose 100 pounds in 2 weeks? Well, I'm sure 80 pounds of that was water. So what's that? 10 gallons of water that he lost, that he peed out. His heart got better. And a month later, he walked out of there holding his dog. And he was not perfectly healthy, but he was functional and he had no swelling or anything. His heart was much improved. So there are ways to increase the energy of the heart. And one way to do that, you build mitochondria when you get anabolic. And anabolic means fasting. That when you're fasting, you make a hormone called ghrelin, growth hormone releasing hormone, that causes you to release growth hormone that tells your body to start repairing. And one of the things you repair is mitochondria. So I don't know how many mitochondria he had, but I'm sure he was very deficient in mitochondria in his heart cells. By the time he left, I'm sure he had twice as many mitochondria, and because his heart was functioning twice as well. So that energy systems are a big part of heart disease. People that have atrial fibrillation, arrhythmias of the heart, ventricular tachycardias, all these like arrhythmias. And what do you do if you go to the doctor? They ablate part of your heart, meaning they kill part of your heart that does the pacing so that you don't get those arrhythmias. And okay, that works sometimes. It's okay. But it's not the ideal way to go. The ideal way is to increase the number of mitochondria so that you actually get normal heart function. You get full contractions, and they don't start going in weird directions, or everything works together because there's enough energy in the whole system. So that's heart disease in a nutshell.
Wow. Okay. So yeah, we'll have to rewatch that one probably, right? But such good information. And so let's say maybe we have a problem with our heart, we've been diagnosed with something, or we want to make sure that we do not have heart problems. Where do we start? Okay,
start with the problem. So if the problem is energy, then increase your energy. There are some supplements that include L-carnitine, coenzyme Q10, D-ribose, and magnesium. Because why? Those are common deficiencies. And when they're deficient, then you don't make energy very efficiently, and you decrease the number of mitochondria. And so it's been shown like CoQ10 L-carnitine will stimulate your body to make more mitochondria so that you can make more ATP, so that you can get more energy in your systems. And that would be the heart partly, but your brain and your muscles too. It's not just one thing. Another really important thing for the heart is exercise. You cannot build muscle, bone, whatever you want to build up, you're not going to build unless you stress it. And so the exercise is essential stress for the heart. And I hear this very commonly. And even recently, I had somebody. He was told by his cardiologist, "You're stressing too much. Don't work out. Don't go to the gym. Just relax. It's okay. Just relax." I'm like, oh my gosh, a cardiologist is giving advice to someone to not use the heart. That is crazy, because how are you going to build anything? You can't build muscle or mitochondria if you don't actually go out and stress it and do something. Yeah, sure, you may have to start small and gradually work up to more and more and more exercise. You don't go out and run a marathon, when you have congestive heart failure. That would be dumb. But you just start with, like, I had a patient who could barely make it to the mailbox without getting chest pain. So then I told them, okay, just go to the mailbox every day. After you're no longer getting chest pain, then just go a few steps more. And each day just add a few steps, not a lot, just a few steps. And in a year, he was walking around the block twice. And his energy systems improved because he pushed it just a little bit each time.
Interesting. Okay. There is a question here about our healthy heart supplements. I'm going to go ahead and share that. Now, does this have everything that you would recommend?
Well, okay. So the purpose for healthy heart support is to be an adjunct to the Healthy Heart Solution Kit. So you're going through the program, you're doing the stress reduction, the exercise, the eating program, doing all that stuff, getting enough fiber in your diet. And then we add this in because it has the CoQ10, the L-carnitine, to increase the mitochondria, to increase the energy. L-carnitine is to help you get fat into the cell, into the mitochondria, so you can burn fat for energy. And everybody thinks, oh my gosh, you don't need fat for energy. Your heart uses glucose. Well, yeah, 40%, but 60% of your energy comes from fat. And that's important. You need that. You need that ability. So the carnitine is in there. And then we add beetroot and olive to increase the nitric oxide so you can dilate your blood vessels. Not so that you will, but so that you can. So that the areas of your body can relax the blood vessels and allow better blood flow. That will drop the blood pressure, which is really that's not the important part. The important part is you're getting good blood flow. And then this other thing that we put in there called ashwagandha. What is that? Well, that's an adaptogen to help your adrenal glands to adapt to stress so that you don't have this excessive output of adrenal hormones. It kind of keeps the adrenal hormones from being overburdening the system, because the adrenal hormones, specifically cortisol, is a catabolic hormone, which means it's breaking down your body, including breaking down mitochondria, breaking down connective tissue like your blood vessels. And cortisol prevents you from repairing the damage done to your blood vessels. So it causes these plaques to form in your arteries. So stress is a big deal. We talk about that a lot in the Healthy Heart Solution Kit. So that's why this supplement is not, it's different than you'll never find anything like it, because it's like, wait a minute, this is all over the place. It's like dilating blood vessels and energy system and working with the cortisol. Yeah, because these are all the issues that happen with the heart. And so it's an adjunct to the Healthy Heart Solution Kit.
Okay, and both of those can be found. Actually, if you go to bartonwebinar.com or bartonnutrition.com, you'll find those. Use code webinar25 to save 25%. I'm going to dig into some of these questions here in the Q&A. We answered this one from Julie. There was another one about the heart I wanted to quick ask. Oh, Rose had said, can you explain about the electrical part of the heart when it isn't working because Rosa's sister has angina?
Okay. Angina is probably not specifically related to the electrical system. The electrical system is, this is really cool and it's amazing. The electrical system of the heart is a modified heart cell. Okay, they're actually heart cells. They're just like the muscle cells, but they don't contract. And so it's a modified muscle cell that conducts. And this is kind of important so that things flow properly because we're dealing with fluid dynamics here. So we want the atria up top to squeeze the last bit of blood into the heart to fill that chamber, the big heart chamber completely. And then next, after that contracts, then we need the big chamber to completely contract and push all the blood out the aorta. So that's how the system works. And so what happens is then the impulse starts in this atria, starts there, and it's conducted down. And it's a kind of a slow conduction. It's not like an electrical wire. It's a little slower. It's conducted down and it goes all the way down to the bottom tip of the heart. So by the time this is completely contracted, now the other part, the ventricle is starting to contract, and since it's all the way down, they all contract together. Well, not exactly together. It starts then over one side and goes around the heart as the contraction goes like this and then like this, and eventually the whole thing contracts and then it can relax again. And so it's a beautiful system. It's like amazing. And what can happen is if you don't have enough mitochondria, then you don't make that conduction. And some of those cells may not be able to relax fast enough because they don't have enough ATP. So if you're low in ATP, then they don't relax fast enough, and they're still relaxing. And the next impulse is coming around, and everybody else is starting to contract, and then they contract, and then this other cell that was slow is now starting to contract. And so that's where you get arrhythmias, where things don't contract together. They're contracting at different times. And so it's an energy problem. It's just a problem with energy. So that's the electrical system of the heart. Now, what's angina? Angina is what we call the chest pressure that you feel because the heart is in distress. And the heart is in distress because there's something that's not functioning. It's not getting enough blood, so there's not enough oxygen. It's not getting enough energy, somehow usually oxygen. And so as you're trying to do stuff, you're walking and you need the heart to beat harder, but it doesn't have enough energy to beat harder. So it's starting to get into stress, and it's spasms. And those spasms of areas of the heart are felt as pressure. And sometimes it can be severe. People say it's like an elephant sitting on my chest. That's angina. It is, if the whole heart spasms, then of course that's deadly. So that's why it's so dangerous to have this angina. Sometimes that blood vessels are constricted because the autonomic nervous system constricts the blood vessels, stops the blood flow, and people get angina. They could just be sitting there doing nothing and get angina. And it's real chest pain, and it's really damaging the muscles of the heart because they're really not getting enough oxygen, even though it's not because of exercise. So, and that's one reason why the cardiac stress tests are not very accurate. They don't predict a heart attack, for example. When you do a stress test and the doctor says, the cardiologist says, clean bill of health, you're good. Yeah, your heart's as good as mine. And then then 2 days later, the person has a heart attack and dies. And you're like, what? I've actually seen that happen. I didn't make that up. Like, what the heck? How could you 2 days after having a clean bill of health die of a heart attack? Well, it's because the blood vessels can constrict from the autonomic nervous system, stopping the blood flow and then creating a heart attack.
All right, very interesting. This is giving me a lot of ideas for other topics that we can do as well, because you're covering a lot of information. I just keep thinking, if people were going in for doctor's visits, would they get this much information in this short amount of time? I wonder. This is good.
You wouldn't.
Okay. Question here from the Q&A. Elmar said, 2 weeks ago, you mentioned the FLCCC protocol. So the frontline doctors, how do I know if I have the recombinant spike protein, and what test should I request?
Yeah, good question. I have tried to find that spike protein test, and they only allow it for investigational purposes. None of the labs around here have it, and I've even gone to some of the specialty labs, and they don't have a spike protein. So that would be a great test if they would allow us to use it. But the test that I usually use is D-dimer. D-dimer, fibrinogen, sedimentation rate, and the C-reactive protein. So those tests give you an indication if there's inflammation. If the D-dimer is high, it means you're making clots in your blood vessels. And if you're making clots in your blood vessels, you can assume that you probably have long COVID, whatever that is.
Okay.
Virus, plague, and it's really an assumption. You can't actually do the test to determine that. You have to assume from looking at these other tests to say, oh, that must be what's going on. So inflammation is high, clotting is high. There's no other reason for it. You don't have rheumatoid arthritis or something like that. In fact, I had a patient in this morning, who she had all these symptoms of pain in her joints and fatigue, and she couldn't get along. We did a D-dimer test, and it was really high, like 0.75. It's anyway, it was really high. And her sedimentation rate is high and all that, and all of the rheumatoid and ANA and all the autoimmune was negative. So we assumed a long plague protocol, and so she started it, and she's doing a lot better. She's actually she's functional. She says, I still have pain in my shoulder when I go up like this, and she still has a wrist issue, but most of the pain has gone away. And she says, I actually have energy now. I can do stuff, whereas before I could barely go to the kitchen and get something to eat. Now I can walk around the block. So it's a big difference.
Awesome. Okay, someone's going to ask me for those tests again. The D-dimer,
fibrinogen, sedimentation rate, the C-reactive protein, and then of course I always look at a CBC as well.
Okay, good stuff. Anonymous says, when scheduled for surgery, it is usually recommended that we avoid using omega-3 supplements for several weeks. Does this also include avoiding omega-3 foods? Also, why is that? And maybe I shouldn't, this is probably not appropriate, but I feel like they always tell you to stop taking your supplements before you have surgery. Is that really necessary?
Probably not, but it's one of those things. I don't know what it does, therefore don't do it.
Yeah.
So as far as before surgery, not taking omega-3s, they're concerned about bleeding, internal bleeding. And one of the things we want to happen is we want to prevent the blood from clotting inside your veins and arteries, right? That's why we're taking these in the first place, because heart disease is vascular disease, is clots in your blood vessels. And so if we can take omega-3 oils and prevent clots in your blood vessels, then we can prevent heart disease and we can prevent vascular disease. And so, yes, that's why you're taking it. But on the other hand, if you're going to have surgery, you don't want to bleed out. They can cauterize things, but the little teeny bleeders that are all over the place, they will clot nicely if they're allowed to clot. But if you're taking a blood thinner, something that's going to thin the blood, then they can bleed and bleed and bleed and create problems. So that's why they do that. And you know what? It's just stop it for whatever your few days before doing the surgery. Just what they tell you to do is fine, because you really don't want to bleed out. And then when surgery is over and you're healed, start taking it again.
Yeah.
It's okay.
And in this one, it says several weeks before surgery, which is interesting.
Yeah, several weeks. The reason for that is because those omega-3s become part of your blood, and it lasts for a few months. And so, it's not just a few days. It's not just what you had yesterday or the day before. It's like over the last, generally about 3 months. So they say several weeks. That's okay.
It is interesting though, because Anonymous is asking, well, then what about foods that have omega-3? So they don't tell you to stop eating fish or sardines or whatever.
Nah, you can't control for everything. They just don't want this high amount of omega-3 that's going to block the clotting mechanism.
Okay. Okay. I think we talked about this after Christine asked the question about how to increase mitochondria. We talked about that.
Yeah. Okay. So it's kind of like building muscle. You can take all these muscle building supplements, L-carnitine. In fact, there was one, I read this one, it was hilarious. This article on how you could sit on the couch and build muscle by just popping L-carnitine pills. And then people, they say you can build bone by taking this Boniva or whatever, all these drugs you can sit in front of your TV and build bone. And you know what? None of that's true. You don't build mitochondria by sitting around. Really, all of the building requires stressing it. If you don't stress it, it doesn't build up. And so if you want to build bones, stress your bones. Like go out and pound the pavement, literally, and that stresses your bones and you build bone. If you want to build muscles, stress your muscles. Go to the gym, work out, run, do something that's going to build muscles. And if you want to build mitochondria, stress them out. And that means using energy to your limit. That means reaching your limit of energy, whatever that is. So I like the HIIT programs. That's high intensity interval training, because the high intensity is when you push to your limit. You go, this is as fast as I can run. And it's only for 10 seconds. It's not like you have to do it for a long period of time. It's just getting to your limit so that your body starts going, I've reached the limit. I better start making some mitochondria. And they do. And that's how it works. And then secondarily, then looking at the supplements. So yes, I talked about the supplements. CoQ10 that has been shown to increase mitochondria. There's another one called PQQ, pyrroline quinoline quinone. And since nobody can say that, they always say PQQ. And there's another one, L-carnitine. We talked about that one already. And magnesium is essential. And then the D-ribose is actually really important too, because a lot of people don't get enough plants in their diet to get this sugar called ribose. And it's sweet and everything, but it's not used for energy. It's actually used to make DNA, deoxyribonucleic acid. That ribo is the ribose. That's the sugar that you're eating that your body needs. So, excuse me. So that those are the ways. The primary thing being pushing to your limit. The secondary thing being using those supplements.
Ginger from San Jose says, I have a watchman in my heart to minimize risk of stroke. It's an umbrella type device. Is that similar to the umbrella to plug the hole in the heart? I no longer take blood thinners.
Oh, very interesting. No, not really, but in a way. So this, if you've ever seen one of those umbrellas, the Watchman umbrella, it's like some little torture thing or something. It's got the umbrella it's got these hooks in it, and so it goes into your artery, your aorta, so by your heart. So the heart's beating over here, the aorta comes out, and this Watchman is in there, hooked into your aorta. Like these are like hooked in, and then the other part is like an umbrella, yeah, and it catches all the clots that come through there. Yeah, see those little hooks on there? That's like, oh my gosh, it's horrible looking. But yeah, it goes in there, and so that um, there's like a cloth, like a cheesecloth that catches all the clots, and then gives them a chance to dissolve as the blood goes by them. And so that so you don't throw those clots up into your brain, because 20% of the clots that form in your heart are going to end up in your brain. So that's really what this does, is just to catch the clots, and then they'll dissolve. They're supposed to dissolve.
Wow.
Your body's supposed to do that.
Very interesting. Look at all this fun stuff we've gotten to see and learn today. Okay, Tommy said, if I go on a week fast, should I stop taking supplements? I've been doing the program for 2 weeks and I still feel bloated.
Wow, that will help your bloating a lot. Yeah, 2 weeks, that'd be great. Yeah, don't take supplements while you're fasting. Look at supplements as food. Fish oil, I was just talking about, it's food. It's all, it's concentrated food and extracted, and it's a processed food. But it's just food. So while you're fasting, just stay off the supplements. The purpose for the fast is cleansing, detoxing, and so you don't need to add anything in there. There's people are always trying to sell something, like selling you a fasting kit that you can eat this food and this food and this food. No, fast, get off all that stuff. You don't have to pay $250 for a kit to learn how to fast. It's really, really cheap to do it yourself and do nothing at all. Water's free, right? Almost. So and then the other thing is the supplement. Same thing. Just stay off them.
Okay, Julie says, I have a friend who's had 2 strokes, and I was pretty certain her stress was the biggest factor. I've given her a bottle of the Healthy Heart supplement, and I think she stresses with cortisol, and it seems that causes her belly fat.
Yeah, belly fat. Okay, so here you have a situation, and this is kind of important. I'm glad you brought this up. Is that someone has had 2 strokes, not 1 stroke, 2 strokes. If you have 1, it can happen. Some people get 1 and they never get another one or whatever. But 2 strokes, that's really a harbinger of something that's like coming down the pike. Like she could get a massive stroke from from whatever that same area, whatever's causing that to happen. So that means there's clotting in the arteries, and it could be in the heart. So if the clots are formed in the heart, they go up and cause a stroke. If it's in the carotid arteries, if they're forming clots, then they can go up into the brain and cause a stroke. So wherever those clots are coming from, it would be important to know why you're making clots. And so looking at the blood tests, the ones we mentioned already that were for the plague, that are the long plague, those same tests, you're looking for clots. And then we have the whole list of things, of tests to do that are in the kit. So when you open up the book, look at the kit, and you have all these tests, the alpha lipoic acid and the D-dimer and the CoQ10 and the antibody levels of cardiolipin antibodies, all that stuff. So that list of tests, those are all looking for sources of where the clotting is coming from. So if you have a lipoprotein A problem, you got to fix that, and it's not hard. If you have a lipoprotein A problem, you're going to be taking nattokinase, just like on a daily basis. That'll be your supplement because that dissolves clots. Because the lipoprotein A prevents the dissolution of clots, so you have to add in an enzyme that will dissolve it. So looking for the source is really the best way to prevent it, not taking a supplement necessarily. I mean, if your source is your omega-6 to omega-3 ratio is 20-1, then yeah, you've got to get some omega-3 supplements. So dealing with the reason, the underlying reason, and not just randomly going off on stuff.
Right. Annette said, this is my first webinar. I joined to lose weight and heal diabetes so I don't get diabetes 3. I'm here to learn all that I can to get my health back. And then the next question from Annette is, so we fast without anything for several days?
Okay, so yesterday, Annette was probably on the fixed blood sugar webinar yesterday, and we talked about dry fasting. Somebody brought it up. And I have a patient that does it, and I do it 3 days, once a month, 72-hour fast, once a month, and it includes no water. It turns out that the research on animals shows that no food and no water, having an empty stomach, the more you have an empty stomach, the better, period. There's just no way around that. It's the empty stomach that gives you all the benefits. Why? Because your empty stomach produces a hormone called ghrelin, growth hormone releasing hormone, which is only produced when your stomach is empty. If you put water in there, you stop making it. So as long as your stomach is empty, then you're making this ghrelin, and you go into what's called anabolic metabolism, which is the rebuilding and repairing metabolism. And it takes about 48 hours or so before you start into something called autophagy. Auto means self, and phagy is feeding or eating. So you're eating yourself. That sounds awful, doesn't it? But what's really happening when you're eating yourself is you're eating up all the junk, all the junk that collects. You guys have houses or apartments or whatever. And if you've lived there for 10 years, then you've got stuff in that corner and stuff in that corner and stuff built up on that table, and every drawer is full of junk that you haven't looked at in years. And that's what your body's doing too. It's building up all this junk. And in the brain, we call them tau proteins. These proteins, they just sit there. They're useless. They had a purpose. But after they've been used, they haven't been cleaned out. So what happens when you fast? You clean them out. So the answer to your question for type 3 diabetes, which is really just one manifestation of type 2, called a metabolic dementia, you can prevent the metabolic dementia by doing this, 72-hour dry fast once a month. And it will clean out all those tau proteins out of your brain, and everything will be squeaky clean in 3 days. And it's so cool. It even takes out all the dead cells, cancer cells. The body says, "Oh, we don't need these cancer cells. Let's just eat those up." And so your immune system literally goes in and eats them, digests them, and spits out the amino acids so that you have amino acids you don't have to eat because you're eating yourself. That's what autophagy is.
That's a lot. I won't show you pictures of that one.
Did you look them up?
No, I didn't. But the idea of it is cool. It's good. The body really is amazing.
Someone asks, how do you take your meds when you dry fast?
Okay. So there are some medications you just take. So if you're on a thyroid medication, just take your thyroid. There are some people are on medications that they need a constant level, like especially medications for like depression or schizophrenia or those kinds of things. You just take them. So, and if you take them with water, fine, take them with water. This doesn't have to be, you don't have to be obsessive about it and go, oh, I can't eat anything, I can't drink anything. So for example, last weekend, I ran my normal 5K. And I'd already fasted for 2 days and I was really thirsty. So what I do, I went and drank some water, for heaven's sake. I'm not going to sit around being dehydrated for another day. So I drank water. It's okay. You know, if you get thirsty, drink some water. If you get hungry, just push through it. You know what? It only lasts 10 minutes anyway. But for taking your medications, if you require water, or some people say, you know, I can't take this without food or something, then have a little bit of food, or, you know, whatever, take it with something. That's okay. And it still works. It still works. So other medications that you definitely do not need to take, or probably do not and probably should not take, include things like omeprazole, things for stomach acid. You shouldn't be taking those. Things for blood pressure probably will cause hypotension, low blood pressure, and dizziness, and nausea, and all those issues. And then medications for blood sugar, because you're not eating, so you're not getting any blood sugar. So if you drop your blood sugar, you're going to get hypoglycemic, which means you're going to get fatigue and weakness, and you know, brain dysfunction also. So yeah, those are some medications you probably should not take. But then depending on the medication, some of them you should.
Okay, so there are many questions that we still have left. And so what I'm thinking is next week, we just dedicate the webinar to just answering your questions. If you guys are okay with that, I hop on right away next week and just post your questions in the Q&A so that we can start right away and get to as many of these as possible. If for some reason we run out of questions, no problem. We'll talk some more about the heart because there's a lot to be discussed. But I want to get to some of these. I know that some of these are important to you guys. So hop on early next week, post them in the Q&A, and we'll get to as many as we can. Dr. Saunders, thank you so much for being here. We'll see you next week. Have fun with the Barton, doesn't say brothers, but they're not brothers. The Barton dad and son.
Yeah, I will.
Very fun.
See ya.
Bye. And there might be a few questions we could answer on here right now. Someone had asked if the Healthy Heart Solution Kit is the downloadable PDF that they maybe have already purchased, and likely yes. But if you're looking for it, it should be at bartonwebinar.com.
And Ella asks, how can I replay this webinar? Also go to bartonwebinar.com. That'll take, I don't know how long it'll take to post this one.
Yeah.
You can also find it on our YouTube channel, but there will be a replay later. Yeah.
Yep. Subscribe to the YouTube channel.
Susan asks, what type of magnesium do you recommend? Dr. Sonner says any.
Yeah.
Yeah. Just take any magnesium
And
switch them up if you want.
Barton has a magnesium product on our site right now. So go to Barton Nutrition. It's a spray magnesium. I use that every night. Use code webinar25 and you'll save 25% on that. Anything else? Okay, I think that's probably it for now. Okay, like I said, guys, come back next week. Post these in the Q&A right away, and we will get to hopefully a lot of them. That'll be the goal. So think about some other questions maybe you have and bring them next week. Okay, thank you, Cheryl.
All right. Thank you, Leslie. See you all later.
Bye-bye.
Bye.